Hello, dear friends. Good evening. We are back with yet another episode of BMC Global Live AlHilal Health World, nothing but lifestyle. This talk show is exclusively with expert doctors of AlHilal hospitals and medical centers. Children are mostly affected by seasonal changes. Summer related diseases in children vary from UTI to skin infections. The doctor joining us today is Dr. Abuzer Surka from AlHilal Hospital, Sitra. He is an experienced pediatric consultant and he has attended many international pediatric conferences in India, Middle East, Europe and the US. So doctor, welcome to the show and thank you for joining us today.
Thank you so much. It is my pleasure to come here and share my knowledge with everybody.
So doctor, what are the summer related infections we usually find in children?
Yeah, as we know, the months of summer bring the heat. Along with that, they bring so many illnesses for our young population, especially small children. So most common infections in summer in children are, first of all, they can affect the stomach and the intestine. So they like diarrhea, vomiting and other stomach related illnesses. That is the most common. Secondly, they are very common also is the urinary tract infections, which are seen in the children, especially if they are sort of exposed to a lot of heat and if they drink less amount of water or liquids. Thirdly, as we all are affected by heat exhaustion and heat stroke, similarly the small children also are affected by this heat stroke and heat exhaustion. And lastly but not the least, when as in Bahrain especially, we have a lot of humidity, especially in July and August months, and because of the humidity there are many skin related ailments also which are seen in the children. So this is on a whole, we are as a whole we can say that almost every part of the child's body is getting affected by the summer. So I would like to make everybody like aware about the symptoms, how we can manage them and how we can prevent them. First of all, that would be our main topic of discussion today.
So now you mentioned about the stomach related infections. So can you explain it in detail for us?
Yeah, sure. So stomach related illnesses mainly we see in our pediatric OPD, lot of patients with diarrhea, vomiting, especially during the summer and the humid months. They eat food which may not be hygienic, which may not be sort of suitable for in this hot weather. Like especially hotel food, they go to restaurants and eat food which may not be sometimes up to the mark. And also they are more common with certain bacterial infections of the stomach and the intestine, like diarrhea, dysentery, vomiting, stomach upset and also food poisoning. These are very common during the summer months and they may present with severe diarrhea, severe vomiting, dehydration and also high grade fever. So these are the main symptoms for the illnesses. And then when they come to us, our first priority is to stabilize the child. If child is having dehydration, we first sort of replace the body fluids. We try to control the vomiting and then we try to investigate. Usually they are viral illnesses more commonly, but sometimes they can be bacterial. So we need to investigate, need to test the blood and the stool if there is diarrhea to reach to our conclusions. We have got in our AlHilal healthcare, we have got very good facilities even for the culture and sensitivity to find out the specific organism which is causing this diarrhea or the illnesses or the stomach infections. So we can treat specifically with the proper medicines and proper antibiotics, and hence this is how we manage the patients with the stomach related illnesses.
What are the treatment options for the stomach related infections?
See, treatment options vary from sort of emergency care, like where there is severe vomiting, diarrhea, there may be dehydration associated. Sometimes because of the dehydration, there may be some electrolyte disturbances like sodium chloride or potassium may become alarmingly low. So that is the first step of treatment, that we have to stabilize the vitals and the electrolyte parameters of the child. Secondly, we try to find out the exact cause of the illness, like is it bacterial or viral, and if it is bacterial, what is the causing organism. So then accordingly we give the specific antibiotic treatment if required. If it is viral, we just have to give supportive treatment and we have to replace the fluids, control the symptoms like vomiting, diarrhea, and we have to stabilize the patient. Along with the medical treatment, very important part is giving the dietary advice to the parents, what to give and what not to give, especially when there are stomach related infections. Because in children there is something called secondary malabsorption. Means that after a certain viral illness, the intestine may become weak to digest the normal food also. So during those times, I as a pediatrician advise my patients that during those times we have to avoid certain food and only give the food which is easy for digestion, which will not cause secondary diarrhea. Because what happens many times, the patients come with the first symptoms of diarrhea, that may be actually due to some, microorganism, some virus or bacteria. Once we treat it, then the patient goes into the phase of secondary diarrhea. It is called secondary malabsorption. Because of that, because why this happens, that due to that infection of the microorganism, the intestine mucosa or the intestine itself on the inner part, which is important for digestion, that gets damaged. So when that gets damaged, then the child cannot absorb even the normal food which you are giving before that. So the parents may get panic or may get anxious that my child got again some infection. But that second episode may not be due to infection, may be due to some other causes. So a very important part of the treatment is also dietary advice to the parents.
We know that UTI is very common during summer.
Yeah.
Please explain for us about UTI in children.
Yeah, the second most important system to get affected is the urinary system in children, especially younger children when they may not take adequate amount of liquids during the
Liquids, yes.
daytime. And as we know, high temperatures leads to dehydration also very commonly, especially if the evenings they go to the park to play, and this is also vacation time in Bahrain. So usually children go out to the parks and play, and because of their exposure to humidity, the child may get dehydrated very fast. And then when there is a less amount of water in the body, obviously the child will pass less urine. When there is less urinary flow, the bacteria get time to sort of proliferate, to grow within the urinary system. Especially the urinary bladder and the urinary tract. The bacteria which are normally present, but they are not causing any problem. They may begin to increase in number in a sort of big way. And because of the large numbers of the bacteria, the child may get urinary tract infections. Now, how it presents, if it is a small child less than 5 years of age, the child will only cry while passing urine and may not be able to tell the symptoms specifically. Maybe sometimes complain about lower abdominal pain, or maybe the child is afraid to go to urine because of the pain, or sometimes the urine may not even come sufficiently. These are the symptoms the parents may come to us. Obviously, older children may give us direct complaints of that. They may tell us directly that they are having pain while passing urine. And then we take a proper history and we come to find and we find out that the child is not taking adequate fluid intake. So then obviously next question comes that how do we reach a diagnosis?
Yes.
So diagnosis is very specific and very easy to make, because when we suspect urinary tract infection, we always go for urine analysis and a urine culture. And now in AlHilal healthcare, we have got a facilities for culture for all sorts of body fluids, for blood and the urine also. So when we go for urine culture, we get to know the specific organisms which are causing this infection. Because when when we have to treat urinary tract infections, it is very important to know what is the culprit, who is the culprit, which is the organism, because there are so many organisms which can cause, and there are so many antibiotics also. And antibiotics are specific for the specific organism. So we need to first know which is the organism so we can treat the child appropriately. And secondly, after a urine analysis, when a urine, we have checked the urine, we also are concerned about our kidney functions, as we know that the kidney is very important part of the urinary system. So we have to check the kidney function by certain blood tests. Plus we have to do one ultrasound to check whether there is any other damage to the kidney or not. Usually in the first episode of urinary tract infection, we don't go for ultrasound, but when there is recurrent UTI, which is also fairly common after the first episode. And one point I would like to tell you here is that urinary tract infections are more common in girls than boys, mainly basically because of the closeness of the urinary tract to the genital system. So it is very important to keep in mind that girls should always, when there are any symptoms of itching perineum or they have got difficulty in passing urine, we should always think of urinary tract infection and do the proper checkup for that. So if they are recurrent UTI, we go for first of all ultrasound scan, and if required, it is not treating or it is a resistant UTI, we have to go for further scan, CT scan also, and there are some the special radioisotope scans which can help us diagnose the exact condition of the kidney and the urinary tract system and how we should go about it. So this is how we diagnose and we treat. And again here the parental advice is very important, to advise them that the child should take adequate amount of liquids per day in any form, not only plain water, they can take some juice, some soups, but liquid amount should be appropriate to ensure the smooth and continuous urinary flow, so that the bacteria do not get a chance to grow again and cause the problem recurrently. That is how we manage.
So this is all about UTI.
Yeah.
So doctor, Can you explain more about the heat stroke, how it affects children?
Yeah, that's a good question because see, heat stroke affects everybody, even adults, and similarly the young population. I mean, children are more prone because of they got a more body surface area as compared to the body weight. So they are more exposed when they are exposed to the sun. They are more likely to get dehydration and sun heat stroke. What is heat stroke or heat exhaustion? That is, in plain terms, it is a form of severe dehydration when the body fluids get depleted, get reduced so much that it affects the circulatory volume of the body, and then it can cause the sort of multi-organ symptoms. Like it may even affect the brain. The child may become unconscious, and so it is actually a very serious condition. We should not reach that point. So here the main point is to preventing heat stroke in children. We should not allow it to happen. So how? What are the precautions we should take? So first of all is that avoid prolonged exposure to the sunlight for the children, especially during the harsh summers in the afternoon. Do not take them out in the sun or in the parks or the open spaces. That is the first and foremost thing. Secondly, ensure adequate food intake because summers the body is very much highly prone to get dehydrated because the fluid loss is very severe. Even when they are in the shade also, they may there is an ongoing fluid loss because the body tries to maintain the inner body temperature within a normal range, and the outside environment temperature is very high. So there will be obviously fluid loss from the body. So continuous giving adequate fluids when you are when you are going out, even if you are in a mall or you are in a shaded area, the fluids should be adequately given to the child. This is how you can prevent heat stroke. Once it happens, it is a medical emergency. We have to immediately stabilize the fluid volumes, do certain investigations to find that there is no other organ damage, and try to try to do sort of replenish the reduced body fluid and try to save the child as soon as possible.
Now, we would like to know about the skin infections during summer in children.
See, skin infections are mainly happen during the humid climate conditions, and in Bahrain we know that in July and August, as the summer progresses, the humidity also increases, and because of the increased humidity, first of all, the skin infection most common is the fungal skin infections, because fungi like to survive more in the humid conditions. So especially where there are skin folds in the groin region, perineal region, or in the neck region, also in the axilla. These areas where there are skin folds and closed areas, that body humidity is always more, and where we sweat those areas. So those areas there is more chance or more likely to get fungal infections. So how, first of all, how do we prevent it in children? So keep those areas dry. If the child is sweating, child is small, child may not take care of or take care of himself or herself. So the parents should keep the areas dry, try to wipe up the sweat regularly, and keep some sprinkles of baby powder. So keep the areas dry, and then if in case the child goes for some infection, immediately consult a pediatrician or dermatologist, and they will be the right person to guide you, give the proper specific like antifungal medications, and the child can be cured. But if these fungal infections happen again and again, then there is a chance that child may have some reduced immunity. There may be some immunity problems, because whenever child has got reduced immunity, the child is more prone to the fungal infections. So in that case, if your child is having recurrent episodes of fungal skin infections, always go to an experienced pediatrician who may have his knowledge and may sort of investigate the child for any immune disorders. And we also have to concurrently, while treating the infection, also go for this immunity treatment, also immunotherapy, so that the child may not fall sick again and again.
Now, you have described most of the diseases, summer-related
Yes,
diseases in children.
yes, yes.
Now, what's your advice for the parents of young children this summer?
Yeah, I would like to give advice, give the proper care of the children. In short, I would like to say that first and foremost, most important is avoid the exposure to the harsh summer heat for your children. Secondly, keep them hydrated properly. Keep adequate amount of liquids. Avoid sugary drinks. Avoid these aerated drinks, because they actually contribute to the dehydration. So don't think that giving aerated drinks like soft drinks will help the child. It is actually going to harm the child. Instead of that, try to give homemade juices, or you can give even this like laban, yogurt. This all help to keep the body dehydrated. Also keep the gut strong, keep the stomach and intestine strong, because this yogurt, laban, they all contain the probiotics. So this helps Lastly, give adequate amount of calories. The child should not be calorie deficient because that keeps the child strong, keeps the child's immunity better. Lot of fruits, vegetables, obviously, because they are good in fiber, they have good amount of liquid or fluid within them. And lastly, as far as possible, avoid the restaurant food if you can. Give as much as fresh food as possible to avoid this like food poisoning and other illnesses. So this is how we should take care of the children during this summer months.
So, doctor, before we wind up, what do you have to say about AlHilal Healthcare?
Yeah, as a group, AL-HILAL Healthcare we aim to provide affordable and accessible healthcare, and in that same our motto, we provide wide spectrum of services to treat all sort of pediatric illnesses. As far as my department is concerned, we treat all sorts of pediatric illnesses, whether it be summer, winter, or any climate, any day of the year, and we provide a comprehensive facilities for full checkup, all sorts of investigation, laboratory, radiology, where we can give the best care for a child, and we do manage all sorts of pediatric illnesses, and we strive to keep the children healthy and just treat all their sicknesses.
That's great. Now, thank you, doctor. Thank you for joining us.
Thank you so
and
much.
giving us a lot of information about summer-related illnesses in children.
Thank you so much, and I am always available at AL-HILAL Medical Center, Sitra, and as I got around 30 years of experience, so I would be very happy to serve you and try to give the best advice to my patients. Thank you so much.
Once again. So, viewers, I hope this was a very informative episode. As doctor said, take care of the health of your children during this summer. Till we meet again next time, this is Jessila Mujib signing off. Good night.